So my name is Dr. Vibhor Gupta. I'm the founder of Pangaea Data Limited. We are headquartered in London with an office in South San Francisco. We operate mostly in the US and Western Europe currently, and we have just started work in Asia Pacific through initial discussions in Japan and in Singapore. So as we have seen through our experience in Pangaea, that artificial intelligence has a big role to play in precision medicine by virtue of, for example, with Pangaea, being able to find more undiagnosed patients, which is a big problem in medicine, given that up to 90% of patients can be undiagnosed across 7,000 hard-to-diagnose conditions. And I've been invited here to HIMSS to talk about one such work that we completed with the National Health Service in the UK, where applying Pangaea allowed us to find 6 times more such undiagnosed and untreated cancer patients with cachexia and bring them into clinical care. Just to give you a sense, cachexia is highly prevalent amongst cancer patients, refers to muscle loss and muscle wasting, but is terribly underdiagnosed and leads to 20% casualties. So you can imagine, by bringing these patients into clinical care, especially when the data is already available, has a big impact on those patients' lives, their quality of life, and their families, and also clinicians and healthcare providers. Not to forget the pharmaceutical companies who also benefit, given that they already have therapies on the market to treat such patients or help such patients, be it through commercial therapies or clinical trials. So in oncology, I've already provided an example regarding cancer cachexia, which we have been invited to talk about at HIMSS. But broadly speaking, we have, in oncology, it's a very well known that there are patients who perhaps have been diagnosed but are still not being brought in for tumor genetic testing, which is a project that we have completed and shown the results for in collaboration with UIC, which is one of the larger academic medical centers here in the US. Similarly, we have seen patients who have been diagnosed but are not being brought in for liquid biopsy screening. And that was a presentation we made at ESMO in Paris just this month, where we showed how applying Pangaea's product, which applies AI, we were able to find 30 to 40% more patients for lung and ovarian cancer who should have been brought in for liquid biopsy screening. So I've just mentioned 2 cases where we are finding patients who've been diagnosed but are not being brought into the clinical care pathway. But this also applies to undiagnosed and misdiagnosed patients, like I described in the cancer cachexia example earlier, where we are finding 6 times more such patients who are hidden in plain sight in spite of all the data being available. So this is just the tip of the iceberg that Pangaea is able to address at this moment in time. But there are several other applications of artificial intelligence in oncology which can help improve patient lives and more importantly, help the treating physicians as well. So in the context of early diagnosis, again, if you're a physician, you have to think about it in the context of, are there patients in the system who should be treated but are simply being missed because they are either undiagnosed, misdiagnosed, or miscoded. And AI, as Pangaea has shown, can help discover such patients. I already gave examples around that. Not just in oncology, but in other conditions like COPD, CKD, lupus, and about 7,000 other hard-to-diagnose conditions. And this is, of course, on the back of processing retrospective patient data. In similar vein, you could apply the same methods in the context of prospective data, so at the point of care, to help physicians ensure that if they are treating a patient for perhaps another condition, they at least have knowledge that the patient is a suitable candidate for being screened for something else. Case in example is a patient came in with a problem of the appendix, but if the patient records suggest that the patient should also be screened for CKD and should be sent in for an EGFR screening, that would be worth their while, because that would also define the following treatment care pathway. So my co-founder, Professor Yike Guo, who's the director and founder of Imperial College's Data Science Institute and currently president of Hong Kong Science and Technology University, has brought in $110 million in grant funding to work on large language models in medicine. And this is with a twofold focus. Number one, of course, to help us accelerate the work I described earlier, which is to find more undiagnosed patients across 7,000 hard-to-diagnose conditions, but also to help engage patients better. Until now, we always focus on how we can bring more patients into care. But it's also very important to engage those patients, because that's when care becomes successful. And that's where we see a huge opportunity with large language models. So just to give you some context, I'm sure you have family and friends where every time they visit a physician, they would like to consult another friendly physician, and try to understand the context of whatever the medical reports are suggesting. That's exactly where LLMs can help. And that helps with greater patient engagement and, of course, patient activation, as we call it. So motivates them and helps relieve their stress, and in most cases help them get much better. So if you're applying AI in the clinic, in the context of healthcare or life sciences, one of the most important aspects is of explainability. So you have to be able to explain the results, because that's when a clinician gets the confidence that this is actually meaningful and it's not coming out of a black box. And so that's number one. Number two, it's about privacy, as the question suggested, which is patient data is sacrosanct, it cannot be transferred, and it certainly cannot be shared outside the contours of compliance. So it's very important to deploy such AI within the infrastructure of the hospitals to help those physicians and those patients without needing to move the data to a third place or to move it outside the compliance regulations. And the third aspect of this is, of course, having a business model that allows for financially sustaining the application of such AI models continuously. So it's not just a one-time activity for a specific project, but it's a continuous activity which can continually help clinicians and physicians in a privacy-compliant manner and in a scalable manner. So absolutely. So we have an example of that following our work with UIC in Chicago, which I referenced earlier, where the treating oncologists wanted to process data through Pangaea for lung, breast, and prostate cancer patients to understand if there are patients who have been diagnosed with these conditions but are still not being brought in for tumor genetic testing due to health equality reasons. And as we completed the project, we found that social indicators and demographics were a big driver for implicit bias against these patients. Now that was an empirical evidence which suggested that there is implicit bias in the system, and now the clinicians can actually put a check on that, and they can do something about it. And this is not to point a finger at anyone, but this is really just data helping drive behavioral changes and policy making to help those very patients for who they are there in the first place. So Pangaea, like I said, is a team of engineers, clinicians, and scientists headquartered in London with an office in South San Francisco and majorly doing work in the US and in Western Europe. As a business, we provide a software product platform to help our customers, who are clinicians in healthcare and in pharmaceuticals, to find more undiagnosed patients, which comprise or which can be up to 90% of the patient population across 7,000 hard-to-diagnose conditions. As you can appreciate, this is very important for pharmaceutical companies from a medical affairs, commercial, or a clinical trial perspective, but most important for clinicians in healthcare so they can bring in more patients and treat them to improve their outcomes, reduce the cost of treatment, reduce the health burden by reducing readmission rates, and also plan for their resources more effectively, over and beyond what they could do with a de-identified data set for epidemiological or outcomes-based research only. At Pangaea, our mission is to help improve patient outcomes in a privacy-preserving and a financially sustainable manner. And by bringing together pharmaceutical sponsorships with treating physicians in healthcare in this privacy-compliant manner and in this financially sustainable manner, we feel we have a method which will allow us to spread this across the globe, not just in the developed nations, but also in developing countries and countries who perhaps might not have the benefit of the technical infrastructure, but still have the potential to help those very patients in the manner that I described earlier.